We are recording now, and this audio recording will be broadcast and electronically manipulated by vertical internet radio. And is that something that you give us permission to do with this audio file?
Yes.
Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you for joining us today. Our guest in studio is Dr. SooMi Lee-Samuel. She's medical director of Timberline Knolls Residential Treatment Center, also board-certified psychiatrist. And she's a returning guest here to talk with us about some of the warning signs that let us know that one of our young women or adolescents is struggling with an eating disorder. Welcome to Health Professional Radio, Dr. Lee-Samuel.
Thank you for having me.
Thank you. You know, we were here before in other segments talking about Timberline Knolls Residential Treatment Center. Tell us, what is your role there other than medical director?
So as medical director, I oversee administrative duties here at Timberline Knolls, and then I also am involved in direct patient care. So I do follow some of our patients on our lodges, and I work with them as a psychiatrist and work with leading the treatment teams into managing the clinical treatment for our individuals here.
Now, I understand that your facility treats women and young girls exclusively for eating disorders, and some of the, I guess they're called co-occurring disorders that go along with an eating disorder. When we're dealing with an eating disorder, we don't often know it. When a patient comes to you, it's already in full effect. What are some of the warning signs that we can look for and maybe begin to think about letting you become involved?
Absolutely. So the behaviors may start off kind of subtle, and so it's important to kind of really monitor closely, especially our adolescent girls. We find that a lot of adolescent girls can be very sneaky, and it may not be so obvious. And as parents, we may be more likely to dismiss some behaviors that we think are just, part of growing up during adolescence. But if you start seeing a young girl starting to have interest in diets, regardless of her weight, if she may be normal weight, but she's starting to become a vegetarian or go vegan or starting to become gluten-free, and she's doing it without being monitored by a physician, then that's something to kind of be aware of. If someone starts to refuse certain foods, there may be something called fear foods, where certain foods trigger a fear reaction because they're afraid they're going to gain weight. So if they start suddenly refusing to eat certain foods or avoiding foods, that's something to keep in mind of. If you notice that suddenly they start going to the bathroom after eating a meal, you need to ask yourself, why are they doing that? They may be purging, and so you want to be aware of that as well, too. And then suddenly, if they start exercising compulsively and a lot more often, so maybe several hours a day where they used to not do that. Now, I recently had experience with someone who was actually on the cross-country team, and she started exercising more frequently, and she used the excuse, well, she's on the cross-country team, so she needed to work out more, and she needed to maintain a healthier diet. That's understandable, but then when the behaviors get so restrictive that this person was only eating maybe 500-600 calories a day, then that's something that should really raise a red flag in parents and practitioners.
Do you ever find that an eating disorder develops out of something that was totally, a great idea, healthy, maybe, started wanting to eat a healthier diet as opposed to fast food, and then something happens and now you're in a full-blown eating disorder?
Yes, that's quite common. And, there's definitely, I don't want to bash vegetarianism. I think having a vegetarian diet is a very healthy choice, and it's a good idea for a lot of people. A lot of our young women start off becoming vegetarians, but then what we notice is that it gets more restrictive. Vegetarian turns to vegan, turns to raw food, and so what starts off as a healthy idea turns into a control issue, and it becomes an issue about wanting to control what you put in your body, and that's when it gets concerning, and that's when we should really start to take notice.
Do you ever find that the workout regimen that someone has been instructed to undertake because of a sport is actually not right for them particularly?
Yeah, I think coaches may mean well and they want their, athletes to be healthy, but I think that we need to have a very open and honest communication with, for example, the coaching team. If your daughter is on a cross country team, but you notice she's eating less and she's exercising more, I think we need to have a very frank discussion with the coach and say, "Hey, what's going on? Did you notice this is going on? Did you instruct this or recommend this?" And not be accusatory, but see what's going on, because it may very well be that the coach may not be aware of it. And so I think open communication is going to have to be very important.
When we were talking about warning signs, there are more than a couple that sounded very familiar to the same type of warning sign that you would look for in a child or a young woman that's abusing drugs. How often do you see these eating disorders and substance abuse together?
Well, we know in our adult population, some studies have shown that up to 50% of women with substance use disorders also have a comorbid and a co-occurring eating disorder. So a lot of times at our facility, what we see in our adult women who are maybe in their early 20s who have been using substances, but also have an eating disorder history, they come in to get treated and to maintain sobriety. Let's say, for example, they were using heroin and marijuana. Once they're in our facility, they're able to become sober and maintain sobriety, but then what we notice is that the eating disorder behaviors start popping up. And it's almost like the substance use was masking the eating disorder behaviors, and it's almost like, I call it whack-a-mole. As soon as you treat one disordered addictive behavior, the other one kind of pops up. And so that's what we see, which is why I think it's so important to treat co-occurring disorders. And so a lot of times when someone is sober, then they'll start restricting again because they don't want to deal with eating again, because when they were high, they didn't have to think about eating. So, but now that they're sober, they have to think about what they're eating and what, food again, and that is very distressing to them because they've never dealt with it before.
Now, not all levels of addiction or eating disorders, for that matter, require a residential stay. But when it is required, how does an individual or someone who's observing that individual know that, hey, they need to be checked in someplace for a residential level of care?
Right. Well, for a residential level of care, what we really look for is someone who's failed lower levels of care. So maybe they've done a PHP program many times. Maybe they've been detoxed in the hospital but haven't been able to maintain sobriety. Or maybe they've been in other treatment facilities, but it just hasn't taken. So what we look for is someone who's tried other levels of care, and usually it's PHP or outpatient, and it just hasn't been working. And usually for insurance companies to authorize a residential level of care, you have to demonstrate and show that they failed a lower level of care so that the insurance companies would be willing to cover it. Or if someone is in an inpatient psychiatric hospital and they've been in the hospital multiple times for multiple suicide attempts, then maybe they can come to our facility and try coming to our facility for treatment.
If you've got a male who's identifying as a female, can he develop eating disorders based on his identification, or is it actually a real thing? Because you do specialize in women's issues, but men suffer from eating disorders as well.
Absolutely, absolutely. And it really, whether or not you're homosexual, heterosexual, bisexual, transgender, you can develop anorexic, eating disorder behaviors, bulimic behaviors, just as easily as a woman can. It just happens that women tend to develop eating disorder behaviors more commonly than men. But as I said before, there was that one study that estimated that 1 million men in the U.S. had some kind of disordered eating disorder behaviors as well, too. So definitely it can happen in both genders.
And where can our listeners go and get more information about your practice?
Absolutely. Our website is www.timberlineknolls.com, or you can call us at 1-844-335-1932. Great.
Well, as always, it's been a pleasure talking with you today.
Thank you for having me.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with returning guest Dr. SooMi Lee-Samuel. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.